So anyone with infectious diseases or disorders, obviously you wouldn't want to treat for any treatment, not just Swedish massage. And the reason being, you don't want to contract anything, and also you don't want to pass it on to any other clients who may be in the practice later on in the day. Anybody who is under the influence of alcohol or drugs, that's recreational drugs, there's a few reasons for that, and it's a very difficult one because a few spas and a few practices kind of promote come in for a nice relaxing day with your friend and have a complimentary glass of champagne or a complimentary glass of wine, something like that. And really it's not ideal, and you shouldn't be treating anybody that has actually had any drink of alcohol. The first reason being is, how do you know that they are consenting to this treatment? If they've had quite a lot of alcohol to drink, they may not be able to consent to the treatment that you are going to provide. The second reason is any type of massage increases the circulation through the body, and if they do have alcohol in their systems, then this can push the alcohol around the body, and it can actually make your client feel very unwell. Anybody who is under investigation for a medical condition, you really need to ask some questions. If somebody comes in and say for example, they say, oh, I've got this lump, or they're not too sure about this, I'm having to go off for blood tests regarding a certain issue that I've got at the minute, you need to wait until they've actually got a diagnosis so you know whether it's safe to treat them or not. Clients with uncontrolled either high or low blood pressure, you do not want to treat. If somebody has been on medication for more than 12 months and they have got a very well controlled blood pressure at the time of treatment, then that is absolutely fine. People come in all the time who are on medication for either high or low blood pressure. As we mentioned earlier on in the presentation, osteoporosis is something that you really must avoid. Okay, so there are a couple of different types of massage other than Swedish massage. The second one being deep tissue massage, and that is exactly how it sounds. You are applying quite a lot of pressure onto the client to get through to the deeper muscles. Another type of massage is Thai massage. This is quite commonly carried out with the client and the therapist on the floor on a mat. The client is dressed in very loose clothing, and quite often the Thai massage therapist, they do quite a lot of stretching with the client. Sometimes they're actually kneeling or standing on you, so it is an interesting treatment. Aromatherapy massage, this is more of a relaxing treatment with use of essential oils, and the aim is to really tailor the treatment to the individual, to your client who is in. So for example, if they have been struggling sleeping, then you would use a very relaxing essential oil to try and help them get a little bit more sleep and sleep a little bit better. Another treatment is lymphatic drainage massage. Now that actually works with the lymphatic system. It's a very light treatment, and the type of people who may go for that is people who have had either an accident or an injury or an illness which has damaged part of the lymphatic system, maybe the lymph nodes. Maybe somebody has had cancer and has some lymph nodes removed, for their auxiliary lymph nodes removed from the armpit, and the lymphatic system just really struggles getting the fluid back up. So what a lymphatic massage therapist would do is very light pressure just to help try and move that fluid for them. Okay, so that concludes the presentation. If anybody has any questions, please feel free to ask. I hope you've enjoyed it. Thank you.